Today I'm doing Agnes for under eye bags. And the way I always like to start Agnes under eye bags is with some numbing. So I'm gonna do an eye block just for the lower eye, and that way you can see, because it's really hard to find these videos, training videos on how to do an eye block. So I'm going to find first that little notch. There's your infraorbital nerve right there, where that comes out. Okay, I'm gonna warn you before I do anything. I'm gonna come right over here, ready? 1, 2, 3, la 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 la. So I'm gonna put about 1 to 2 cc's here. Perfect, you doing okay? Mm-hmm. Awesome. Great. Great. And I'm using just lidocaine with some epinephrine. Okay, and then I'm gonna come laterally. I have you turn your head this way. And I'm gonna come about 1 centimeter out from her lateral canthus and about 1 centimeter down. We're gonna numb right here. Ready? 1, 2, 3, boom. And I just like to do a half to 1 cc. Right there. And that's usually enough right there. And then we're gonna go a little medially. So I'm gonna go from her medial canthus and go down and aiming away from her eyeball. I'm just gonna put my finger on your eyeball. And I'm gonna come right over here, okay? 1, 2, 3, here we go. And just a little, like half cc. I know it's so annoying, isn't it? Mm-hmm. Yeah, she agrees, it's annoying. Okay, done.
Could be worse.
Okay, good. All right, awesome. So now we're gonna go to the other side. So since I'm gonna have to reload, so we're gonna start over on the lateral canthus first, 1 centimeter, 1 centimeter. I'm gonna start right here, okay? Mm-hmm. 1, 2, 3, here we are. Right there. You got it. So easy. Excellent. And we're gonna come medially. I'm gonna put my finger on your eyeball. We're gonna aim away from the eyeball. Okay, so we're gonna come back, find that infraorbital fossa right here. Okay, then we come right down here. 1, 2, 3, hi. Okay. So good, you're doing so good. I do like to put a little bicarbonate in it so it doesn't sting as much. But, so if we were doing, I'm gonna just take this and do this. If we were doing her upper lids, I would also put 1 or 2 cc's up here in the supraorbital fossa. I put it right straight over, I pull it out a little bit, then I aim it down the corrugator, I pull another 1 cc that way. So that's how we can numb this whole area up here by doing those 2 injections. But we don't need to do that today, so we're not gonna. So hang tight, we're gonna wait for her to be numb, and then we're gonna do the Agnes. So now I'm ready to do our Agnes, and Agnes is microneedling with radiofrequency. So we get that little tiny needle into the skin, then I pulse, and the radiofrequency goes exactly where I want it and just shrinks up that fat pad. So that's what we're gonna do, shrink fat pads and get rid of it. So I'm gonna use my Jaeger to help push our patient's eyeball a little bit so we can see exactly where that fat pad's going. I'm gonna start, you're okay here? Mm-hmm. Awesome, 1, 2, 3, we're gonna go this way. And I'm gonna go all the way here. You okay? Mm-hmm. Here we go again. And down. Ooh, did you hear that sizzle?
Yeah, that was crazy.
That was cool. I typically recommend 2 sessions, spaced 3 to 4 months apart. And I always recommend doing Scarlet with it. So we're gonna do the Scarlet right after this. So good. But before we laid our patient down, as you can tell, we outlined where her fat pad actually is, because everything changes when you're laying down. So much good sizzle, I love it. And intermittently, I do need to wipe off our needle. So other areas you can do Agnes would be under the chin, buccal fat, which is like jowl fat, anywhere, if you've had like a fat transfer or you've done lipo and there's like irregularity where the lipo was, we can smooth it out with Agnes. You can also use Agnes to lift the tip of the nose, like that. You can do a brow lift with Agnes by treating the under the eyebrow and into the forehead. So there's lots of things you can do with Agnes. If you had lipomas, these are little fatty collections on your body, we can use Agnes there. Usually those are surgical. Not anymore. Thank you, Dr. An from South Korea. And it was originally made, you did great.
Thank you.
It was originally made by a doctor in South Korea for treating acne. So you can treat acne with Agnes. And the reason why it's named Agnes is because it sounds awfully like the word acne. But you just destroy the glands, so you won't have recurrent acne. That is a bit of a process though. That's typically 3 treatments spaced 1 month apart with extractions done before and 3 days after every Agnes treatment. But it's a great treatment for that. So issues that people can have with Agnes, you could bruise. That's why we do Scarlet after to help decrease that. And I always like to put hydrocolloid dressings on afterwards. They're like fancy band-aids to help keep those little openings hydrated and protected from anything in the environment. Clean, I mean. So we'll do that at the end. So Scarlet is microneedling with radiofrequency as well. And what this does, it helps it tighten and lift. So we get rid of the fat with Agnes and then we tighten and lift with Scarlet. I know you might hate me a little bit, but I'm gonna have you open up your eyes and look up to me.
Oh God. It's the scariest angle.
Yes. I know. But just look up that way. You don't have to look at me with these
Can I
glasses
look at
on.
the fire
Yeah,
sign?
you can look at whatever you want. So I'm gonna start right here, okay?
Mm-hmm.
Is that okay?
Yeah.
Okay, good. So there's 25 little tiny needles. They are tapered. They go in linearly and robotically. So they just kind of ease their way in. There are other machines that are solenoid, which means they stamp their way in. They're not tapered, like Morpheus is what I'm talking about, not tapered ends, so it's a lot more painful. Does this hurt?
No.
Okay, good. So now I'm gonna do one more pass, so we like to do 2. And by we, I mean the royal we, I like to do 2. But I always combine Scarlet with Agnes. And they just work well together, especially if Agnes is causing any kind of bruising. Having the extra radio frequency from the Scarlet helps that. You're doing so good. I'm so proud of you.
Thanks.
Yeah. All right, last one. Perfect. Scarlet is the only microneedling radio frequency device that has the na effect, which means that as the needles come down, they are poking at your fibroblasts to make you make collagen. They release radio frequency when they get to the depth that you've programmed in. Got that so far? So they release the radio frequency, which the radio frequency is the heat that irritates a fibroblast to make collagen. As the needles come up, the radio frequency follows the needles. So every layer of your skin is going to get that tightening energy, which is unique in these microneedling radio frequency devices. So a big reason why we chose Scarlet. We could have picked any of them to buy, but I love this device. Okay, you got this. You're doing so good. 4 more pulses only. And you can do Scarlet anywhere you have skin because it is great for tightening and lifting. So we could do your arms, inner thighs, above the knees, your abdomen, if you had stretch marks, anywhere back of the butt, wherever you have skin, you can tighten it using Scarlet. And look, there's no downtime. I mean, she looks great. She has a little tiny bruise right here. I know, they're so cute. This white is just from my lidocaine block. That'll go away in about an hour. Your eyes will feel back to normal in about an hour. But she's really nobody's gonna know what she did. And then I'll have her, so aftercare will be to go home and put a clean pillowcase on your pillow.
Okay.
So that way, just in case there's any kind of bacteria on there, you're not just rubbing your face all over it.
Right.
I'm going to give you the hydrocolloid dressings that you're going to leave on until they fall off.
Okay.
If you do get a bruise, bruises are always complimentary here. You can always call in, and then we can get you to lay under the LED light, which we do complimentary as well,
Okay.
which will help speed along the healing process.
Okay.
So, and then no mud wrestling.
Oh, darn.
Yeah, don't take out the garbage and then wipe your eyes. Like, just keep this area clean.
I'm just gonna tell my boyfriend that you said I can't take out the garbage at all.
You
Yes.
cannot take out the garbage, do any laundry, no dishes.
No cleaning.
Anything that has to do with cleaning is off limits for at least 3 months.
Oh,
Is that
wow.
asking too much?
No, that sounds right.
At the very least, a week. So, and at the very least, probably like 2 days. But
Yeah.
anyway, I can write you a prescription that says that if you want.
Just hand it to him.
Yeah, exactly.
Perfect.
So then you come back, you'll do Scarlet again in a month.
Yeah.
You'll do Scarlet again in another month. With the 4th Scarlet, you will do Agnes again. Then you'll come back and do 2 more Scarlets. So it's typically a treatment course of 6 Scarlets, 2 Agnes. And her eye bag should be beautiful. So if you want to find out if Agnes and Scarlet are right for you anywhere on your body, you can find us online at RejuvenationMDmedspa.com, but you can also find us on Instagram, YouTube, Facebook, all of the social media platforms. Most importantly, just find us. See you soon.